So describe pitta bandu padana causes excessive intake of hot, spicy, sour and pungent foods. Aggravating pitta, excessive exposure to sun and heat, excessive anger and mental stress, vitiating pitta kapam. Pitta chronic infections and fevers, depleting blood quality. Clinical features: yellowish discoloration of skin, eyes, nails and urine, excessive thirst, burning sensation in the body and soles, loss of appetite, bitter taste in mouth, giddiness, low grade fever and excessive sweating, bounding, rapid pulse. Management: internal medicine, pitta pacifying preparations such as Nellika legium, Amukara Churanam and cooling iron tonics. Diet: cooling, sweet and bitter taste predominant foods. Avoid spicy, sour and fried foods. Buttermilk and fresh fruits encouraged. Cooling head application in pittam pacifying side. Avoidance of sun exposure and anger provoking situations. Adequate rest. Silerpana Bandu Varlar Tirum Tira clinical features and management. Excessive intake of excessive intake of sweet, oily and heavy to digest foods, aggravating carbon, sedentary lifestyle, excessive daytime sleep, cold and damp environmental exposure, poor digestion, weak acne leading to formation of poor quality serum, blood theory. Clinical features: pallor with puffiness, edema of face and limbs, heaviness of body, lethargy and excessive sleepiness, loss of appetite, nausea and excessive salivation, cold and clammy skin, slow pulse. Kaba nadi characteristics. Management: internal medicines, kaba pacifying and digestive stimulant formulations. Pacifying and digestive stimulant formulations such as Tirikadagu Churanam based preparations and iron tonics. Light, warm, easily digestible food, pungent and bitter taste predominant foods. Avoid dairy, fat and sweets. External therapy: powder massage, podi thimirdal and steam fermentation to reduce heaviness. Lifestyle: regular physical activity, avoidance of daytime sleep. Ratta Bandu causes. Clinical features and management: causes disorders directly affecting blood ratham quality and quantity, chronic blood loss, menorrhagia, bleeding piles. Nutrition disorders directly affecting blood quality and quantity, chronic blood loss, menorrhagia, bleeding piles. Causes: nutritional deficiency of blood forming elements, iron, folate. Disorders affecting blood quality and quantity, chronic blood loss, menorrhagia and bleeding piles. Parasitic infestations, hookworm causing chronic blood loss. Clinical features: marked pallor of skin, conjunctiva, nail beds and tongue, generalized weakness, easy fatigability, breathlessness on exertion, palpitation, brittle nails, koilonychia, hair loss, pica, craving for non-food substances. Clinical features: marked pallor of skin, conjunctiva, nail bed and tongue, generalized weakness, easy fatigability, breathlessness on exertion, palpitation, brittle nails, koilonychia, hair loss, pica, craving for non-food substances such as mud in marked pallor of skin, conjunctiva, nail bed and tongue. Marked pallor of skin, conjunctiva, nail beds and tongue, generalized weakness, easy fatigability. Marked pallor of skin, conjunctiva, nail beds and tongue, generalized weakness, easy fatigability, breathlessness on exertion. Generalized weakness, easy fatigability, breathlessness on exertion, palpitation, generalized weakness, easy fatigability, breathlessness on Use palpitation, brittle nails, hair loss, pica, craving for non-food substance such as mudin, severe deficiency, internal medicines, hematinic, the preparations such as lahu basvam, mandura basvam, and karisale karpam, diet, pathiyam, iron-rich foods, green leafy vegetables, jaggery, dates, pulses, and protein-rich foods, treatment of underlying causes, deworming, control of menorrhagia or bleeding, source, lifestyle, adequate rest with gradual increase in activity as anemia corrects தொந்தபண்டு வரலாறு தீரும் நிலை management combined விசேஷன் of all three குற்றம்ஸ் வாதம் பித்தம் கபம் due to chronic neglected or mixed dietary lifestyle errors long standing combined vision of all three kutrams vada pitta kaba due to chronic neglected or mixed dietary lifestyle errors due to chronic neglected or mixed dietary lifestyle errors long standing untreated long standing untreated single kutram band progressing to involve all three doshas combined vitiation of all three kutrams due to chronic neglected or mixed dietary lifestyle long time untreated single kutram progressing to all three doshas severe chronic systemic illness or malnutrition clinical combination of features of vada pitta and kaba pandu mixed presentation severe parallel with generalized weakness edema and wasting mixed presentation severe pallor with generalized combination of features of vada pitta and kava pandu mixed presentation severe pallor with severe pallor with generalized weakness edema and wasting severe pallor with generalized weakness severe pallor with generalized weakness edema and wasting poor prognosis compared to single dosha difficult to treat multiple systemic complications possible combination therapy addressing all three vitiated kutrams simultaneously three dosha balancing siddha formulations along with hematinic preparations அம்மா நாய் இருக்கு பாரு பின்னாடி அடிச்சிடாதட்டும் combination therapy addressing all three vitiated kutrams simultaneously three dosha balancing siddha formulations three dosha balancing siddha formulations along with hematinic preparations combination therapy addressing all three vitiated kutrams simultaneously strict pathyam dietary regimen avoiding all aggravating factors of vata pitta and kapha supportive and prolonged treatment with close monitoring referral for integrated care in severe causes edema described varlaru causes clinical features and management Sobey refers to generalized or localized swelling edema of the body due to vitiation of muk refers general or localized swelling edema of the body Sobey localized swelling of the body swelling Sobey refers to generalized வந்து ஒரு அடி வாங்கிட்டு போ அப்புறமேட்டு தரேன்.
அப்ப நான் அடிக்கணும்.
So where refers to generalized or localized swelling. Generalized or localized swelling edema of the body due to vitiation of mucotrum affecting fluid balance and near circle. Vata Sobe is the type caused predominantly by Vata Kutra vitiation. Causes excessive intake of dry, cold and astringent foods, excessive physical strain, irregular eating habits, suppression of natural urges, chronic constipation, underlying chronic wasting illness, vitiating vata, non-pitting shifting type swelling more in lower limbs, pain and stiffness associated with swelling, dry skin over swollen areas, constipation. Non-pitting shifting type swelling more in lower limbs, non-pitting. தீரும் தீரானலை non-pitting worsens with cold expression and physical exertion, dry skin, overswollen areas, constipation, pain and stiffness associated with swelling. Internal medicines வாத குற்றம் பசிமை வாத குற்றம் management. Internal medicines வாத குற்றம் pacifying internal medicines vata kutram pacifying diuretic and anti-inflammatory siddha formulations. Internal medicines internal medicines vata kutram pacifying diuretic and anti-inflammatory siddha formulations. Diet pathyam warm light easily digestible, avoid cold and dry food articles, warm oil application and fermentation to affected parts, lifestyle, limb elevation, gentle actual avoidance of cold exposure. Pitta excessive intake of hot, spicy and sour foods aggravating pitta, aggravating underlying liver kidney dysfunction, vitiating pitta kutram, chronic infections and inflammatory conditions. Excessive intake of hot, spicy and sour foods aggravating pitta, underlying liver kidney dysfunction, vitiating pitta kutram, chronic infections and chronic infections and inflammatory conditions. Describe pitta sobe வரலாறு தீரும் தீரா நிலை clinical features and மருத்துவ management. Excessive intake of hot, spicy and sour foods aggravating pitta, underlying liver kidney dysfunction, vitiating pitta kutram வரலாறு தீரும் தீரா நிலை clinical features and describe pitta sobe intake of hot, spicy and sour foods aggravating pitta, underlying liver kidney dysfunction, vitiating pitta kutram, chronic infections and inflammatory conditions. Thirum thiran is swelling with local warmth, redness and burning sensation associated fever, thirst and yellowish discoloration of skin, eyes if hepatic origin. Swelling with local warmth, redness and burning sensation associated fever, thirst and yellowish discoloration of skin, eyes if hepatic origin. Excessive intake of hot, spicy and sour foods aggravating pittam, underlying liver kidney dysfunction, vitiating pittam kutram, chronic infections and inflammatory conditions. Tenderness over the swollen part worsens with heat exposure and spicy food intake. Tenderness over the swollen part worsens with heat exposure and spicy food intake management and pitta specifying cooling and anti-inflammatory siddha preparations along with hepatoprotective formulation. Diet cooling balanced diet avoid spicy sour and fried foods. Buttermilk encouraged external diet external therapy cooling local applications. Pitta bowl is over the swollen area cooling local applications cooling external therapy cooling local applications petropolitans over the swollen areas cooling bland diet avoid spicy sour and fried foods buttermilk encouraged cooling local applications cooling bland diet avoid spicy sour and fried foods தினம் தினம் நான் சாகாமல் internal medicines pitta pacifying cooling anti-inflammatory siddha preparations along with hepatoprotective formulations diet pathim cooling bland diet avoid spicy sour and fried foods buttermilk encourage cooling bland diet avoid spicy sour and fried foods buttermilk encouraged external therapy cooling local applications pitta also over the swollen area lifestyle avoidance of heat exposure treatment of underlying organ dysfunction lifestyle avoidance of heat exposure treatment of underlying lifestyle evidence of heat exposure treatment of underlying organ dysfunction evidence of heat exposure treatment of underlying organ dysfunction anemia in children including sickle cell anemia and hemophilia including sickle cell anemia and anemia in children including sickle cell anemia and hemophilia discrete causes classification and management of anemia in children anemia is defined as the reduction in hemoglobin concentration reduction in hemoglobin concentration or red blood cell count below the normal range for age and including leading to decreased oxygen carrying capacity of blood anemia is defined as the reduction in hemoglobin concentration anemia is defined as the reduction in hemoglobin concentration or anemia is defined as the reduction in hemoglobin concentration அனுப்பிச்சிட்டாங்க பாருங்கப்பா ஃபீஸ் அனுப்பிச்சிருக்கேன் 25,000 ரூபாய் அனுப்பிச்சி விடுங்க இப்போ நாளைக்கு கட்டணுமா சீக்கிரமாக கட்டணுமா இல்லைன்னா ஃபைன் போடுவாங்களா கூட 5,000 ரூபாய் சேர்த்து கட்டணுமா anemia is defined as the reduction in hemoglobin concentration or red blood cell count below the normal range for age is defined as the reduction in hemoglobin concentration or red blood cell count below the normal range for age leading to decreased oxygen carrying capacity of blood based on morphology microcytic hypochromic iron deficiency microcytic hyperchromic iron deficiency thalassemia, iron deficiency, thalassemia, normocytic, normochromic, acute blood loss, hypochromic, normocytic, normochromic, acute blood loss, hemolytic anemia, macrocytic, microcytic thalassemia, macrocytic, folate deficiency, normochromic, normocytic, hemolytic anemia, acute blood loss, macrocytic, B12, folate deficiency, microcytic, macrocytic, 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 normochromic, macrocytic, normochromic, based on etiology, nutritional deficiency, anemia, B12, folate deficiency, normal iron deficiency, acute blood loss, hemolytic anemia, B12, folate deficiency, based on etiology, nutritional deficiency, anemia, hemolytic anemia, nutritional deficiency, anemia, hemolytic anemia, sickle cell anemia, thalassemia, hemorrhagic anemia, aplastic anemia, anemia of chronic disease, nutritional deficiency anemia, based on etiology, nutritional deficiency anemia, based on etiology, nutritional deficiency, based on etiology, nutrition, based on etiology, based on morphology, based on etiology, nutrition deficiency, hemolytic anemia, example, sickle cell, thalassemia, hemorrhagic anemia, aplastic anemia, anemia of chronic disease, nutritional deficiency, chronic blood loss, hookworm infestation, bleeding disorders, using iron, folate, vitamin B12 deficiency, most common cause in children, B12 deficiency, hemolysis, sickle cell disease, thalassemia, G6PD deficiency, bone marrow failure, aplastic anemia, leukemia, chronic infections and inflammatory diseases, chronic infection, pulmonary infections and inflammatory diseases, bone marrow failure, aplastic anemia, leukemia, hemolysis, sickle cell diseases, thalassemia, G6PD deficiency, bone marrow failure, aplastic anemia, nutritional deficiency, chronic blood loss, hemolysis, bone marrow failure, chronic infections, and inflammatory diseases. Chronic infections and inflammatory diseases, bone marrow failure, aplastic anemia, leukemia, chronic infections and inflammatory diseases, iron, folate, vitamin B12 deficiency, most common cause in children, chronic blood loss, hookworm infestation, bleeding disorders, hemolysis, sickle cell disease, thalassemia, G6PD deficiency, nutrition deficiency, iron, folate, vitamin B12 deficiency, most common cause in children, nutrition deficiency, iron, folate, vitamin B12 deficiency, most common cause in children, chronic blood loss, hookworm infestation, bleeding disorders, hemolysis, sickle cell disease, நேஷ்னல் ஹைவேஸில் பிசிக்கு வீடியோ எடுக்கிறாங்க, அதான் அனிமியா. அதனால் நியூட்ரிஷனல் டெஃபிஷியன்சி, nutrition deficiency, hemolysis, chronic blood loss, bone marrow chronic blood loss, bone marrow failure, chronic infestations and inflammatory disease, aplastic anemia, leukemia, G6PD deficiency, clinical features pallor of skin, conjunctiva, nail beds and palms. Pallor of skin, conjunctiva, nail beds, pallor of skin, conjunctiva, nail beds and palms. Chronic infections and inflammatory diseases, clinical features pallor of skin, chronic infections and inflammatory diseases, clinical features pallor of skin, conjunctiva, nail beds and palms. Chronic infections and inflammatory disease, clinical pallor of skin, conjunctiva, nail beds and palms, easy fatigue, breathlessness on exertion, poor feeding in infants, tachycardia, systolic murmur and severe anemia, failure to thrive, irritability, tachycardia, systolic murmur and severe anemia, failure to thrive, irritability, systolic tachycardia, systolic murmur in severe anemia, failure to tachycardia, systolic murmur in severe anemia, failure to thrive, irritability, tachycardia, systolic murmur in severe anemia, systolic murmur in severe anemia, failure to thrive, irritability, failure to thrive, irritability, pica, coilonoikia, spoon-shaped nails in chronic iron deficiency, treatment of underlying cause deforming, control of bleeding, treat infection, iron supplementation, oral ferrous sulfate, iron folic acid for iron deficiency, anemia, dietary correction with iron folate and protein-rich foods, blood transfusion in severe symptomatic anemia. Blood transfusion in severe dietary correction with iron folate and protein rich foods, blood transfusion in severe symptomatic anemia. Dietary correction with iron folate and protein rich foods, dietary correction, diet சாப்பிட்றதுனால கரெக்ட் பண்ணும். Dietary correction with iron folate and protein rich foods, dietary correction with iron folate and protein rich foods, blood transfusion, severe symptomatic anemia. Blood transfusion in severe symptomatic anemia. Dietary correction with iron folate and protein rich foods, blood transfusion in severe symptomatic anemia. Special therapy for hemolytic causes as below described: sickle cell anemia, anemia in children, sickle cell anemia. Let's continue.